Righto gents, so today is the big one. Today I want to talk about the elephant in the room. Probably the single biggest reason that most men either avoid getting a PSA test in the first place, or they don't follow up on one that was just a little bit high. This is because all they see is doom and gloom and a sudden and unavoidable loss of everything that makes us men. Yep, today I'm going to talk about sex.
Now, sex. Sex.
You mean sex?
Be warned, I'm going to go into detail here, so if you're prissy or squeamish, maybe you should turn over and watch some Cara and Nate, or some Sailing La Vagabond for some good G-string shots. I want to get through a few things in this video, so some myths perhaps, as well as some of the cold hard truths that you'll probably have with your GP, your general physician in the States, or more likely your urologist or your surgeon, about the stark statistics regarding impotence, what exactly does happen after surgery. Unfortunately, I have to start by saying that my journey won't be your journey. It may be similar, but it won't be the same. This is because we're all individuals.
You're all individuals. I'm not.
So it'll depend on a few things. It'll depend on how early you detected your cancer, what the spread's been, what the biopsy showed, what the relative grades of each biopsy core were, and how fit and sexually active you were prior to surgery. My Gleason score was 7, so it's a 3 plus 4. It's a 90% of a grade 3 and 10% of a grade 4. And given that 50% of the biopsy cores had cancer, indicated to my surgeon at least that surgery should be a priority and should be done sooner rather than later. This news was all delivered rather matter-of-factly, without any emotional thought of support or comments on who or should or could talk to about any of this. Then the surgeon literally said, "I'm free next Friday, does that work for you?" What the hell? You want me to make a decision now? Well, yeah, he said, as if ordering a new microwave. I was reeling at the time. I knew this was going to be a life-changing decision and that whatever happened, nothing would ever be the same. So I closed my eyes, swallowed hard and said, okay.
And we each said, okay.
The first real discussions you'll have about all of this will probably be with the urologist, who will give you a whirlwind of facts, covering all treatment options, from surgery to radiation to active surveillance to watchful waiting, and of course, they'll talk about the dreaded side effects. Incontinence and of course, erectile dysfunction. He'll check the following off his list. Things like you might get 70-80% of sexual function back within 12 months, if you have retrograde nerve sparing that is, but that there's a 50% of chance of long-term, read permanent impotence. Then they go into the rest of the stats like a shopping list, like a 1% chance of a fistula, 3% chance of secondary cancers, a 5% chance of a stricture, a 10% chance of still being incompetent at 12 months. Also things like cystitis, prostatitis, urethritis, on and on it goes. I remember you either write it all down or record it, with permission of course, because it's a hell of a lot to process and you're more than likely going to forget it. Remember here that my first PSA 2.5 years ago was just 3.1, so not especially high, but thank Christ I had a follow-up. This is the first step, being brave enough to find out your PSA in the first place. And remember, you don't need a reason to do it. Being over 45 is enough, especially if you're like me and you had a family history. Then you've got to be tough enough to walk the walk and get another PSA test, which is free in Australia, within 3 months. Then you calculate your doubling rate. If your doubling rate is calculated to, if your PSA is going to double within less than 12 months, you could be in trouble. So then you get an MRI that looks for lesions. Then you get a biopsy that'll confirm if you do have cancer. Then you'll probably get something called a PSMA PET scan to look for other cancers in the body. Then the big decision is the restaurant with too many choices. Either watchful waiting, active surveillance, surgery or radiation. Now, on encouragement from my local oncologist, I did go and see a radio-oncologist who said to me that the chance of me giving you cancer is higher than the risk from the cancer that you've already got. So, no radiation for me. Now, watchful waiting is also doing nothing and hoping it will magically get better, so that was off the table for me as well. Active surveillance is having a PSA and another biopsy in 6 months, as well as follow-up biopsies every 2 to 5 years ongoing. Make no mistake, these are traumatic, painful and invasive, and you'll be ejaculating blood for weeks with each one, which scares the absolute shit out of you. Not kidding. And although it's extremely rare, transperineal biopsies have been known to cause at least one case of cancer spread from the biopsy needle, dragging cancer cells out of the prostate and into the surrounding tissue. It's called needle track seeding. Early days for research, but think about it. It's also a good time to reflect here that as patients, and even though we may not understand the medicine, the anaesthetic, or the many minutiae details and permutations regarding the potential outcomes, we are still being asked to make a momentous decision on the spot that we know will ultimately change our lives. We know at some primal level that hopefully we're going to be free of cancer after the surgery, but that we're going to be left with a litany of other significant problems that could take years to overcome. A radical prostatectomy is not a silver bullet. It hopefully fixes one thing, the cancer, but it leaves you with a few more issues that you almost certainly took for granted beforehand. Basically, incompetence and impotence, both which have huge social and personal implications. And when they ask you, when you want to lock in the operation like it's catching up for a coffee, you're being asked to make this decision with maybe 1 hour or so of actual face-to-face time with your surgeon. That's if you're lucky. In my case, my surgeon was always in a rush, which made me feel rushed, which makes you nervous. And this is after waiting for hours for a 15-minute consultation. They basically vomit all this information at you, expect you to comprehend it, then sit back and say, "So, does next Friday week suit you to totally change your definition of manhood?" What I can hope for is that at least some urologists or surgeons may look at these videos and get the picture that whilst they are definitely the subject matter expert here, as I am in my professional field, they almost certainly haven't had the procedure done to them, meaning their advice is from textbooks and maybe from a little bit of patient feedback. What I want for takeaway for the surgeons and urologists out there is less hubris and better education, so that rather than just regurgitating the statistics, which are important, they can give some confidence that there's going to be some return to normality, and basically try and give some sort of psychological support to men like me. So things like scheduled support options run by a urologist or a psychologist, pro bono maybe, could be one option, either in person or online, where these things can be discussed. I've seen a lot of groups pop up on Facebook, which I'm part of, and also I use my video series, this is part of it obviously, and I use the feedback there as a bit of a forum, and I see there's a lot of really positive comments, and I really appreciate the time that people take to comment on my videos. Anyway, down the rabbit hole we go. So, if you're watching this because you're either having or have had surgery and have the very bleak thought of, will I ever have sex again? I'm going to say it straight and say almost certainly yes, but it's going to be a different experience. Now, this depends on whether you've had nerve-sparing surgery, which meaning hopefully you'll hopefully get back to having sex without any third-party help, which all surgeons hope and promote for their patients, because not to do this is very bad for business. Or if the cancer has progressed and the nerves couldn't be spared, then you'll still likely get back to shagging, but you may need something like penile implants, which is a built-in penis pump. I remember my surgeon describing the pudendal nerves on each side of the prostate like gossamer strands of fairy floss, so protecting and saving them is tricky, especially if the cancer is close to the edge, or the margins as they say. Plus they're doing this using the Da Vinci robot, so that's even trickier. You know, it's like, well, it's tricky. Anyway, my frustration before I get into the nitty-gritty is just how ambivalent my urologist and eventual choice of surgeon were when discussing this with me. And if you've ever watched any of my other videos, you know that I call a spade a goddamn spade. You know, I don't have many boundaries. And look, as I reiterated, the specialists were talking about these topics as if they were planning the next IKEA outing with their wives. It was a bit frustrating. And they gave me the information, but it was given without any real compassion or any context. And the reason is simple. It's because none of them have had the goddamn surgery. So it's just medical journal statistics and textbook recitals. I guess they've got to start somewhere. But anyway, I want to talk about this from the point of view of a red-blooded Aussie male. Now, I'll tell you, in my 20s, I couldn't walk past a keyhole without getting horny. I had a fabulous libido right up to the night before surgery. I love sex, I still do. I remember the last thing I said to the surgeon before going into the theatre was, "Please take care of those pudendal nerves, Doc." Hopefully he did. The only comment I had a few days after the operation from my surgeon on that point was that there was good nerve sparing on one side and partial nerve sparing on the other side. That was it. Nothing written down, no score, no further comment, no indication of what that might mean for my sexual function recovery. The surgeon was more impressed with his actual surgery, particularly the anastomosis, which is the join from the bladder to the shortened urethra where my prostate used to be. Oh yeah, let's not forget that your penis is going to be shorter after the surgery by about 1 centimetre.
Significant shrinkage.
Yeah, hopefully they mentioned that to you. Not once have I heard a man boast about that. Hey honey, it's just like a regular penis, only smaller. Now initially, straight after surgery, your belly is bloody sore because they fill you full of CO2 during surgery. This is to inflate your abdomen to give themselves more room to work, that's fine. But it means that you can't eat anything solid until you fart it all out. And that's what I'm going through. But you can't fart it all out because you've got 5 holes in your gut, which are pretty sore. So you lie there in hospital. You're tired, you're sleep deprived, you're sore, you're wanting to fart, but you can't. You've got a fairly sensitive catheter stuck in your willy, but believe me, things do rapidly get better. By day 3 or so, I was hobbling around the hospital, crouched over and still in some pain. Then I was home on day 4. Then on day 5, it was back to the hospital to get the catheter removed by the nurse. They also do a scan at the same time to check for high creatinine, which could indicate an issue with the bladder anastomosis. Luckily mine was okay, the joint was solid. So after I had the catheter removed, which was painful in itself because the bloody adhesive tape that they use to strap the tube to your leg is like, it must be made of super glue. Anyway, the nurse gave me a party pack to take home on that particular day. This included some pretty blunt literature about penile implants and penile injections, as well as a pack of adult nappies and some pads. Great, I thought. Oh, and what's this? What the hell? It's a penis pump. Oh yeah, said the nurse. Use this at least once a week or so. And that was it. Righto. So anyway, I also left with a script for 5 milligrams of Cialis or Tadalafil, which is meant to help erections by increasing blood flow around the groin during sexual stimulation, which we'll get to in a minute. I also started my pelvic floor or Kegel exercises as instructed by my pelvic floor physio. Now, some of my earlier videos in the series cover these days after surgery, including my continence recovery, which is now definitely at 100%. So I'm not going to go back into that journey. Now, the big one, onto sex. The nurse did say don't use the penis pump in the first week after surgery. Okay, so by week 2, I unwrapped my new toy. I did know that they could have saved some plastic by sending me a shorter one. Oh well. The instructions were pretty clear. So off you go with your Cialis on board. You close the door and start pumping, but only for a few minutes a day, they warn. Now, my own research after surgery was also useful here. I discovered that there is definitely a link between stimulation, yep, that's masturbation, lads, and a return of sexual function. Apologies to any Catholics watching. The reason is simple. Whilst the penis is not a muscle, if you think of it that way, without regular exercise and stimulation, it will wither and sexual function is going to be much, much harder to regain. And of course, it also depends on how active you were before surgery and how difficult, how hard things could get for you.
And of course, to cause the man's penis to erect and then.
I had also been speaking in detail to a schoolmate a while back who'd had the same surgery about a year before me, and he said it took him 2 years post-surgery to overcome his erectile dysfunction. For another colleague, his recovery was slightly faster, even though he agrees that sex is now different, and he said it's not as good. Anyway, I've just passed the 2-year mark, and I can confirm that things downstairs are returning to normal on their own steam. What does that mean? It means without needing larger doses of Tadalafil, which is 20 milligrams, or without needing penile injections. More on these little tidbits later. And there are some other toys you can use as well, like cock rings, which apparently some even vibrate. Think about that. You can go as hard as you like on those. Anyway, back to Tadalafil. I'd been diligently taking my 5 milligrams of Tadalafil, which is and then I was speaking to my local urologist. He told me that taking the 5 milligrams of Tadalafil more than 12 months after surgery apparently makes no difference. So I stopped the Tadalafil, Cialis, whatever. I still have and use a script for 20 milligrams of Tadalafil, and which basically gets the party started within about half an hour and is very, very good, very effective. But I'm also needing that less and less. Now, as an intermission here, I'm going to jump in case I haven't mentioned previously. Clearly, I'm an Australian. I'm also a private healthcare patient, which I do pay a shit ton for. But if you have private health insurance in Australia, you get to choose your surgeon and when you get the operation done, rather than being on the public waiting list for months or even years, by which time the cancer could have spread or metastasized, which is something to think about. So being a public patient is free in Australia, but you don't get to choose anything, your surgeon or your hospital. So I wanted to give myself the best choice of sexual function recovery. All in all, I'm out of pocket by about $18,000, which is about 12 grand in surgery. The rest is in appointments and medications. Look, it's a lot of money, but two things. One, there's no pockets in coffins, but as my wife also said, how much would you pay to have sex again? So, well done, wifey. So, thinking back about 18 months, it's now 6 months after surgery. I'm still taking my 5 milligrams daily Cialis, still using the penis pump, as well as trying to make sure there's some regular stimulation down at ground zero. Either with my wife or by myself. Things were pretty much happening straight away down there. I could get a partial erection within 2 weeks after surgery, which is awesome, I thought. But, I'm all over this like a cheap suit. But then, progress after that got pretty glacial. And I read that the typical regeneration rate for these kind of nerves is about 1 millimetre a day or about 2.5 centimetres a month. And because I have no understanding or benchmark of exactly what was damaged or removed, all I can do is speculate on the nerve regrowth. I can wank a bit more in the shower and basically hope for the best. Now, what they'll certainly tell you before surgery is that you will likely still be able to have intercourse and that you'll still have orgasms, but they're going to be dry. No semen, no sperm. That's because there's no prostate and no connection back to your balls. So medically speaking, the anatomical connection remains between the penis and the testes after a radical prostatectomy via the nerves and blood vessels, but the pathway for sperm release is permanently altered due to the severance, surgical severance or removal of the prostate, and sometimes the vas deferens, which carries the sperm from the testes, from the epididymis, which is at the back of the testes, through your penis and onto the bed sheets. So I can confirm that you'll still have orgasms, and they can be just as intense as they were before surgery, but still the feeling and the build-up is somehow different. I can also confirm that for me at least, my libido, my sex drive, has taken a bit of a dive since surgery. Even into my 50s, I would get pretty horny, even just a few days after sex, the recharge time that men all know about, but we never talk about with anyone. And I now joke that I'm more in tune with my wife, so maybe there's a silver lining because I'm not pestering her so much. Also, I've got to say, the natural erections, they don't last as long as they used to. And now, this is the critical psychological game that I haven't touched on until now. It's like those annoying kids that can do backflips on the beach without even thinking about it. It never occurs to them that they can't, so they just do. That was my experience as well with sex before surgery. Before surgery, it was just, okay, kids are out of the house, we've got 5 minutes. You good to go, honey? Not anymore. We've got to plan things a little bit more, either if you're using penile injections, which I'll get to, or if you're using nothing, or if you're using a PDE5 inhibitor like tadalafil or Viagra, which increase blood flow down to the penis to help achieve and maintain an erection. Sometimes it's the anticipation. Sometimes it's the spontaneity. Whatever the case, there's going to be a change because you're a bit less in control than you previously were. And look, believe me, sex is still great, but part of the challenge now is the performance anxiety as well. So I'm getting better at being in the moment, but it's a challenge when you're either just starting out with some foreplay.
What's wrong with a kiss boy?
Or when you're going hammer and tongs.
Nobody snuggles with max power. You strap yourself in and feel the G's.
Oh, Lord.
All the while, my mutinous hindbrain is saying, I hope my erection lasts. Is my partner going to be satisfied? Is my old fella getting soft? So what I'm saying is there's a lot going on, and don't beat yourself up about performance anxiety. Talk to your partner, get them on board with what's going on and how you're feeling, and even if it becomes a bit of a flop, pun intended, then there's always tomorrow or the next day. Communication here is key. My experience is that sex gets easier the easier it gets, meaning the more you try, the easier and the better it will get, so don't overthink it. Concentrate on the moment, don't concentrate on the member. Boom, boom. Now, I mentioned penile injections. What a great thought that is. Jamming a needle into your penis. I'll never ever do that, you say. A needle into my cock? No way. Well, let's just wait and see, shall we? Do you want to have penetrative sex or don't you? The first time I used penile injections was, I admit, quite the absolute disaster. I was at the urologist's rooms with my wife. The nurse shows me how to do it and smiles and says, okay, now you do it. What the hell? Like here, right now? Well, of course, she said, rather calmly, like trying to coax some more bloody baby food into an overfilled full toddler. Now, we didn't know where to start dose-wise, so I started with 10 micrograms of Cavaject, which is recommended by the urologist. It turned out to be way too much. Now, Cavaject is also known as Trimix, Aprostadil, Prostaglen, E1, Edix, Muse, Vitaros, Viridel, Duo, Aprostan, Alprostin, Alprostapine, Prostavacin, Vastaprostan, Pridax, Prostan VR. Phew, that's a lot. Oh, Jesus. That's a lot of basically the same stuff. Anyway, it was a disaster. I started to get an erection at the urologist's rooms, but boy, was it an absolute friggin' doozy. So the nurse waving at me saying, have fun, go home, have fun storming the castle.
Have fun storming the castle.
Think it'll work?
It would take a miracle.
Which I did, but the fun turned into what is called a priapism, which is an erection that just won't go away, which is far less fun than you might think. Plus, it's dangerous and damaging if you don't get it treated. Now, I'd certainly made good use of that very, very good erection, but it got very, very painful and wouldn't go away more than an hour later. So I ended up calling the urologist's rooms in obvious distress. He suggested I take some pseudoephedrine, Sudafed, and do some stair walking, which basically promotes the blood to go somewhere else rather than your penis. Or you can go and try a cold shower as well.
Listen, Missy, I don't take those cold showers just because I'm dirty.
Anyway, eventually the old fella went down without needing a trip to the emergency department. And yeah, nah. Didn't want to do that either. And anyway, since I've learnt to get used to the injections, I can confirm it. Look, guys, it really doesn't hurt at all. The thought of it is worse than the actual, the bark is worse than the bite, so to speak. The needle is tiny. It's more the thought of what you're about to do and the visual of it. I mean, come on, just look down and think for a moment. Also, the procedure is a bit of a faff around because you have to keep the final needle sterile. But believe me, penile injections do actually do the trick, and they give you a fantastic erection for, well, 30 minutes, as long as you like.
I have a hard-on for you the size of Florida.
Now, about 5.5 micrograms was the sweet spot for me when I was using it, which I've stopped. Now, a Prostadil is about $100 for 10 injections, and it's got to be kept cold in the fridge, plus it loses potency and it has an expiry. Tadalafil or Cialis is pretty cheap. It's only $3 a tablet for 20 milligrams, and obviously they don't expire. Now, look, I'm going to take a break from this video and I'll do some actual practice. Don't worry, I'm not going to practice on myself. This is mostly a child-friendly video, so I'll demonstrate on a carrot for you. Righto, we've got our willing subject here, 1 carrot. This is everything that you're going to need. You're going to need some Alco wipes. You're going to need a syringe. You're going to need your drugs, your Trimix, which is Cavaject, also known as. You're going to need a big needle here, and sterile fingers. What you do is, stay there, Willie. You get your Trimix, you inject the big needle in. You don't use the little needle here, you use the big one. You draw that out a little bit past what you're going to need. If we're going for, say, 5 micrograms, draw it out to, say, 5.5, thereabouts. Turn that upside down, give it a flick. What we're trying to do is get any air bubbles out. Then you adjust it back down to exactly 5. Take the big needle off, put the little needle on, like that. Now this is a very, very, very fine needle, probably like the width of a human hair kind of fine. The reason that you need this one, this is the one that goes into your penis. The reason that you need this one is you don't want to inject this, jab it in there, because it can blunt and it might also bend. In the meantime, you've opened up one of your Alco wipes, and you have to make sure that everything is clean. So you get your Alco wipe out, you pick a side, a left or right, and you rub the side of your penis to make sure the injection site is going to be as clean and sterile as you can. Then you don't jab it. It's your penis. Be gentle to it. It's been good to you. Slowly but surely press it in all the way. Don't wiggle it around like this, because that could hurt. Gently, gently, gently. Press it in, press it in, press it in. And then when it's all the liquids in, pull the needle out. Give it another rub, because there could be a little dot of blood there. And then give it some stimulation and things will start to arise, Sir Walter. And that is how you do a penile injection. Very straightforward and not as bad as you think. And all of these needles go on the sharp spin. And when you're finished, put your Trimix back in the fridge. So it's 2 years down the track, and where am I? My PSA remains at the noise floor of the test, which is less than 0.01, which is fantastic, which suggests that I don't have cancer, which is the only thing that matters here, guys. Now, I stopped seeing my urologist about a year ago because I felt that he couldn't really help me anymore, and he kind of didn't want to help me because he didn't do the surgery on me, so he kind of gave me the cold shoulder, which is a bit frustrating. So anyway, I still use the penis pump occasionally. I haven't used Cavaject, the Prostadil injections, for probably 6 months now, and I'd say my libido has probably dropped by around 50%, but it's still good. Sex is still great, orgasms are fantastic, but erections don't last as long as they used to, and I guess the one benefit of that is there's no need for tissues anymore. So what's the final takeaway from all of this? I guess it's that you'll get the cold sanitized statistics from your urologist, and again, keep in mind that it's likely that none of them have ever had first-hand experience because none of them have ever had the goddamn surgery. So you'll also more than likely get no emotional support from any of them. You'll just get the facts, ma'am.
Just the facts, ma'am.
And just remember, hang in there, be positive, talk to others who have trodden the same path, and remember that the psychological journey is just as important as the physical one. And don't beat yourself up when things aren't working as fast as you want, because the progress can be really, really glacial. And look, while some people are back on the nest within weeks or months, that wasn't my experience. I'd say that's pretty unusual. And I think my own recovery, I'm pretty fit, I'm pretty active. I think my own recovery of around 2 years is pretty normal. Now, what I mean by that is my own recovery under my own steam without any chemical aids. So, yeah, I'm 55 years old now, so keep the hand stimulation up, keep pumping. Remember your daily Cialis as indicated by your urologist, keeping in mind that effectiveness reduces after 12 months. Keep talking to your partner and keep working on intimacy, physical and emotional, which is what we should all do anyway in our relationships. Now, I've also sidestepped penile implants because I haven't had to go down that path. Well, this is very steep here. But remember, if sex is that important to you, then nothing should be off the table. There's also something else that has happened since I've had the surgery. And basically, during one of the rapid fire pre-surgical explanations of everything that can go wrong, the surgeon explained that there was a very, very small risk of an incisional hernia, which is a bulge of abdominal organs or tissue that pushes through a weak spot or hole in the abdominal wall at the site of the surgery, at the site of the incision. This weakness occurs when the fascial layers that hold the abdominal wall don't close together after surgery. Anyway, basically, I thought I felt a bulge a couple of weeks after surgery when planking or doing sit-ups. So lucky me, I had an ultrasound a few days ago and I've got 2 of the damn things. So I'm totally asymptomatic and I can push the organs back through the hole in my stomach. But because I do karate and because I do gym work, it's just something that I wanted to check to make sure that by doing those kind of core exercises, I wasn't going to damage anything. And my GP has basically said that I should be right. I don't want to go down the route of a mesh hernia repair because I hear that there's a lot of very, very bad press for those. So I think the easiest thing for me is to just keep a handle on how much exercise I do and stop if things start to hurt. Now, very finally, you don't have to subscribe. I don't really care. But if you give me a like, that really helps the algorithm and it helps me share this journey and this path with other men that are going to down the same path as all of us that are on this channel and watching these videos. So thanks everyone and good luck getting back to doing what I think we all love.